First of all, thank you for invitation to participate and to talk and to get to know all people and professionals here. Here in Serbia, I'm clinical geneticist, and of course, I'm fully involved in my work with rare disorders. And I will talk from clinical geneticist point of view. But as Stefan already told, we really here in Serbia we work all together, and I think in past 10 years we did a really good job. And if we compare in medical point of view situation with rare disorders before 2014 with situation today, the difference is huge, and this is only 10-year period of time. So before 2014 we were able to establish diagnosis and to employ specific treatment in only small proportion of patients having rare disorders. As in many other countries, we were able to do chromosomal analysis, and to sequence only few genes, one gene by one, which is very, very time-consuming and very expensive and inefficient. And since 2014, thanks to our health insurance, national health insurance company and their decisions, since 2014 we are able to use NGS technology and exome and genome sequencing. And we have started among first countries in Europe with these techniques and diagnostics. And thanks to that, I would say that we can establish diagnosis today and modify treatment in vast majority of patients having genetic disorders. And as you know, 85% of rare disorders are actually genetic disorders. So I hope for the next 10 years that we are going to be equally successful and efficient as we were in the last 10 years. And altogether, this is very exciting time for being clinical geneticist, because all these new possibilities for diagnosis and treatment. This success is, of course, the result of joint efforts of different people and organizations here in our country. Not only healthcare professionals, but also healthcare authorities, which is also very important, media, industry, and of course patient organizations. When it comes to patient organizations, we have National Organization for Rare Disorders, and Stefan told some basic information about our national organization. From our point of view, from clinical point of view, clinician's point of view, I'm very, very satisfied with collaboration with our national organization. And this collaboration is becoming more and more fruitful and easy. And today we have very good, open and constructive collaboration. and people from our national organization are involved in different boards and commissions related to access to therapy, policy making, and various other very important things. Also, we participate together and organize together a lot of medical meetings. And each time when it is needed to raise awareness of some disorder or group of disorders, or promote some therapies and new approaches, we can count on our national organization to participate and to promote, to organize different meetings and to get different professionals together to discuss and to learn from each other. And also over the time, communication with our national organization has become very, very easy and friendly. And I deeply believe that we are all truly committed to further advances and improvement of both patients' rights, accessibility to treatment, to diagnostics, awareness, and everything. So I can just hope that all these good things will continue over the time in the next years, and basically that's all I can say. But if you have any question, I would be glad to discuss further and to answer.